Previously, we started an analysis on the basic operational counseling skills for intervention. After indicating important considerations regarding empathy, rapport, attending behaviors, minimal verbal encouragement, and verbal tracking, now we proceed to see what eye contact, observation, vocal quality and pacing, body language, exploration, and summary are about. When referring to eye contact, we say that it is the counselor's ability to see the client as the client presents themselves during the counseling encounter. That is, agitated, calm, tense, cranky, fearful, sad, without energy, worried, stressed, or happy. This is important because counselors should understand the client without adding any filter or personal assumptions. In order to have appropriate eye contact, counselors would need to consider a couple of important premises. Although counselors should have a general view of the client, focusing on the client's facial expressions allows access to meanings that the client may not be communicating verbally. Depending on the situation, the client could maintain or avoid eye-to-eye contact with the counselor. With this, the client may be communicating a particular interest or indicating a potential issue that needs to be resolved. Likewise, counselors must know how to make eye contact within the cultural context of the client. According to the culture, the client may be more or less comfortable with eye contact. The intercultural skills would be important assets to exert this skill properly, and those intercultural skills are part of the conceptual-procedural skills described by Dr. George Vera. Regarding the observational skills, this is the ability to specifically perceive and distinguish the client's cognitive, behavioral, emotional, and relational factors. By observing the client's operating tones, makes it possible to intentionally distinguish and understand their motivations and reactions, their cognitive consistency and inconsistencies, as well as their emotional range and behavior responses. Clearly, observation is not the mere act of seeing or looking, but recognizing patterns and connecting the dots. It is about identifying the client's operating patterns, meanings, and implications. It is a skill that demands a greater sensorial and rational field in the counselor to understand the client's constellation of human processes. Therefore, the observation reveals the counselor's organizing consciousness capable of making visible the client's patterns in the cognitive, behavioral, emotional, and relational aspects, and also the reasons why such patterns occur and their implication in the client's life. When the ability to observe is not properly developed, the counselor is limited to distinguish the different patterns of the client. Therefore, the counselor's vision of the client is incomplete. And if this vision is incomplete or inconsistent, the entire work plan with the client will be ineffective. When approaching the vocal quality and pacing skill, we understand that counselors need to know their vocal tones to best communicate with the client. At the same time, counselors need to identify the vocal pattern that the client uses when they communicate their situation in the form of ideas and emotions. Changes in the rhythm, tone, and volume of the voice offer accurate information that helps understand the subjective world of the client. The way client tells their story, or the emphasis of the voice on certain verbs and phrases, communicates the meaning between the lines that the client reports as a nonverbal message. Concerning body language, this refers to the ability to understand the meaning of the client's messages sent through the use of their body. Changes in the body posture may communicate the client's degree of comfort. Depending on the subject, the client may respond physically in one way or another. This may discover hidden information and important meanings that could not be disclosed by the client verbally. Besides, the physical distance between the counselor and the client, whether it is too little or too much, may also indicate the degree of confidence, security, and comfortability that the client feels about the counseling process environment. Every counselor must perceive the physical distance that the client makes with respect to them, since this can indicate how important the subject is. When speaking about exploration, this is a skill that allows the counselor to intentionally know the client as a person, their strengths, challenges, needs, dreams, life expectation, and areas to grow. Who is the person of the client, and what are their circumstances? Answering this question is one of the content's tasks of the counselor because counseling is an eminently human process. Accordingly, the counselor must inquire about the areas of the client's life that are functional. This means the areas that are healthy and working properly, making the client live over their difficulties. On the other hand, when the exploration is not done effectively, it is possible that the counselor will create an incomplete image of the client. Although the problem's effect may be known, the plausible causes of those problems would be unknown. And, additionally, the counselor is in high risk of imposing their beliefs when understanding the client. We should know that the human brain tends to complete the lack of information automatically. What do you think this is? Do you think this is a chair? Well, this could be anything. It is just an image. Our brain is completing the lack of information so that our mind is telling us this is a chair. And it can be a chair, but it can also be more than a simple chair. Certainly, it is a bench. When a client tells their story, they might be telling a little part of their life. Usually, it is the little part of their life that is not working well, and they might not see how the rest is working well. Tell me what is working in your life. What is happening in your life that makes it worth living? You have told me about what you want to change. Now tell me, what are those things that are going well that you would like to preserve? These are some approaches that explore the client's humanity as a whole. The door for exploration should always be open. Is there anything else you want to tell me? Exploration has a double purpose: to inform the counselor and the client themselves about the client's functional areas, and to restrict the counselors in imposing their own beliefs. Finally, summary is the ability that allows the counselor to sum up the content communicated by the client in an understandable way. Although observation serves to make sense of the data at a specific point in the counseling encounter, and for the exclusive use of the counselor, summarizing is giving visible meaning to the data as a whole and expressing it to the client. Every element communicated by the client has a structure, but the counselor has to make the structure visible in the client's consciousness. To build effective summarization, the counselor needs to follow up on the issues that the client communicates and connect them accordingly to their affinities. When the counselor is able to summarize the client's communication, the client always has an expressive, emotional, cognitive, and behavioral reaction that can be accompanied by phrases such as,
"You really know how to listen."
"That is the story of my life."
That is an exact summary of my life.
"I think that you have understood me perfectly."
"Yes, that's it."
"What you are saying is exactly how I feel."
You have a really good hearing because you heard everything I said.
On the contrary, in the absence of good summarization, the client would not feel listened to or understood, and essential issues in the client's life may be left out of the counseling process. Having discussed the set of basic operational counseling skills for intervention, we realize how these skills can be understood from three perspectives. If empathy is the skill most based on the counselor's self, rapport is the praxeological skill that makes the counseling encounter to be an in-depth human process capable of helping the other. Based on these skills, attending behaviors, verbal tracking, minimal verbal encouragement, eye contact, observation, vocal quality and pacing, body language, exploration, and summary will operationalize the counseling intervention. And these are the more technical skills capable of being learned through the counseling training. In this sense, the basic operational skills are deeply rooted in the counselor's ability as a person with a genuine vocation to serve others. They are the means that connect the counselor's human side with the counseling intervention technique. and makes the client feel the human quality in the professional counseling encounter. If you like this video, please hit the like button and subscribe to our channel for more content. Thanks for watching.